later.
Where do you want to take me?
Guess.
Endometriosis is a chronic condition where tissue that behaves very similarly to the inner lining of the uterus is found in places that it shouldn't be outside of the uterus. And this can lead to chronic pelvic pain, painful periods, bloating, even GI symptoms. And yes, it can potentially impact your fertility. The video I just stitched, unfortunately, represents the experience of many people when it comes to having a delayed diagnosis of endometriosis. On average, it takes about 7 to 10 years for individuals to be diagnosed with endo. Why the delay? Well, for one, the symptoms can be very vague and nonspecific. Severe menstrual cramps, pelvic pain, irregular periods often can mimic other conditions like IBS, irritable bowel syndrome, also ovarian cysts, ovulation pain, and this can lead to confusion and misdiagnoses. And let's be honest, there's also a long-standing history of women's pain being normalized and/or ignored. As it stands, the current way that we consider gold standard, the definitive way to diagnose endometriosis in a patient, is to do something called a laparoscopy. This is where you make an incision in the belly button and you go in with a camera. This is an invasive surgery. It requires anesthesia. And, this is something that has caused a lot of reluctance of healthcare providers to pursue an early diagnosis. The truth is we can be more practical in our approach. I often will make the diagnosis based on clinical signs and symptoms, but you can also sometimes see it on imaging, on ultrasound or pelvic MRI. You might be able to see some of the endometriotic implants, especially if they impact the uterine muscle. This is a condition called adenomyosis. Or if you see it in the fallopian tubes where it's caused scarring, it can cause something called a hematosalpinx, and this is visible on ultrasound. And you can see endometriomas in the ovaries. It's important for everyone to be educated on how to recognize common symptoms and signs. Severe menstrual cramps, where it is interfering with your ability to go to school or work or function day to day, is never normal. Chronic pelvic pain, pain during or after sex, pain with bowel movements or when you're urinating, having difficulty getting pregnant with some of these other symptoms is a telltale sign. If you're experiencing any of this and if it's impacting your daily life, your quality of life, it is essential to take action. There are both medical and surgical ways to address endometriosis and to improve your quality of life so you're not suffering every day, and even ways to optimize and protect your current and future fertility. My advice on getting answers and advocating for your health is as follows. Document your symptoms. Keep a detailed record of your symptoms, their frequency, and their severity. Having this information on hand can be invaluable when you're consulting with a doctor about your endometriosis symptoms. Number 2, seek knowledgeable care. Not all doctors are going to be well-versed in endometriosis and recognizing it. Don't hesitate to seek out a specialist and get a second opinion if you feel like your concerns aren't being addressed. Number 3, ask questions. Prepare a list ahead of time before your appointment, and I'm a huge proponent of bringing someone along with you because they can provide support and help to advocate on your behalf and help you remember what your questions are and the information discussed. And number 4 is the most important point of all. Trust yourself. Your pain is real. Don't let anyone dismiss your experiences, and it's important to advocate for the care and the attention that you deserve.